All right, we're here at the last few slides in this section on how to assess weight for health. And we're going to talk about using fat distribution to further evaluate being overweight. So if you're someone that is overweight, where you carry your fat can make a difference. If you are someone that carries your fat in your upper body or centrally, this is called android obesity, or it's often referred to as being apple-shaped. And this is a much greater risk to your health because that increase in visceral fat in this area puts you at a greater risk for things like type 2 diabetes, heart disease, high blood pressure, and fatty liver, right? If you're overweight and you carry your fat mostly in your hips and thighs, but you have a normal size waist and upper body, this is referred to as lower body obesity or gynoid obesity. So it's not as much risk to your health in terms of these diseases, but it does put added stress on your hips and knee joints. So how do we know what type of fat distribution you have? We have to do a measurement called the waist circumference. And so for that, you need to take measure. You cannot use your pant size because so many people wear their pants lower than their waist. Right, so you're going to measure around your waist, and here they're showing you the proper technique. And if your waist circumference is less than 40 and you're a male, right, that's a good thing. And if your waist circumference is less than 35 and you're female, that's a good thing. That would indicate that you do not have too much visceral fat. So when we look at populations or groups of people for who's at risk for having upper body obesity, there are four that we want to talk about. Men of all ages, women after menopause, and smokers. Okay, what these three have in common is lower estrogen. Estrogen is a hormone that makes you deposit fat in your hips and thighs. So men have less estrogen. Women after menopause have less estrogen, and when you smoke, you have less estrogen. And then in terms of athletes, ones that are more at risk than others would be the offensive and defensive linemen in American football. And as you can imagine, because you see how big that they are. All right, so that ends this section. When we come back, we're going to talk about energy balance.